it slow. Probably start out as a lurker, look what other people are doing, and see how they're engaging with other doctors or other advocates on social media. Then find a good handle if you want people to follow you so that they know who you are. Learn about hashtags, because hashtags are really, really important. And you'll find out a really big community of friends, virtual friends that become real friends. That's happened to me. And not only in myeloma, I've developed some real friendships with people in the breast cancer community, in the lung cancer community, and all this is on Twitter. Fortunately, I really haven't seen inappropriate interactions between patients and healthcare professionals, but I think as a patient advocate, it's part of our jobs to educate the general patient community as what is an appropriate interaction on social media with a doctor, not to ask doctors specific questions for second opinions, not to even ask doctors for who they would recommend to go see. I think as a patient advocate, we need to teach our patient communities that proper interaction. First of all, it was a wonderful educational tool. Believe it or not, when I was newly diagnosed, I was a passive bystander in my healthcare. I wouldn't engage in conversations with doctors. I was brought up in the age of doctor knows best, so I would just blindly follow orders. So being part of social media, I learned that really isn't the best way to participate in my healthcare. So I become an engaged patient, but becoming an engaged patient and starting to use my voice, I've accumulated a lot of followers on Twitter. I have about 6,000 followers now. And I guess because I have so many followers, I get to come to meetings like this. I was invited to hear the EBMT meeting. I've participated in ASH meetings. And while I'm at those meetings, I get to network with some of the top doctors in myeloma, and we get to chat one-on-one as professionals, not as I'm the patient, you're the doctor. And I think that's one thing with Twitter, it kind of evens the playing field. I'm part of a multiple myeloma support group in the area. I'm on the board of directors of organizations that's called the Myeloma Crowd. And I'm also on the board of directors of the Patient Empowerment Network. Anything I can. I do some volunteer work for the American Cancer Society, and I do some advocacy work with the International Myeloma Foundation. So whenever I can, I help whoever asks me to help out.